Never heard of the medication.
Gabapentin.
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 Called gabapentin.
Gabapentin? Chances are yes, because based on claims data, it's one of the top 10 most commonly prescribed medications in America. But did you know that roughly 95% of those prescriptions are actually off-label? Let's break it down. First, gabapentin is a little bit of a misnomer. It doesn't actually bind the GABA receptor. It's a GABA analog. So instead it binds the alpha-2 delta-1 subunit of voltage-gated calcium channels. This reduces calcium influx at the presynaptic terminal. This in turn leads to decreased release of excitatory neurotransmitters like glutamate, which in layman's terms means the nerve no longer goes. Gabapentin actually only has 2 FDA-approved indications. Number 1, post-shingles neuralgia. Number 2, an adjuvant therapy for partial seizures in people age 3+. Everything else, off-label. What are the off-label uses? Diabetic neuropathy, peripheral neuropathy, restless leg syndrome, anxiety, alcohol use, alcohol withdrawal, chronic pain, multimodal pain, back pain, migraine prophylaxis, insomnia, chronic cough. The evidence for some of these is good. The evidence for some of these are a little lacking. One of the biggest ones I see daily as a neurology resident is for neuropathy. The evidence for neuropathy is actually pretty good. The number needed to treat is around 4 to 5. There's multiple different studies depending on which one you're looking at. What that means is for every 4 to 5 people that take the medication, one person will get at least a 50% reduction in their pain. Gabapentin is dosed 3 times a day. Why is it dosed 3 times a day? Well, it has to do with absorption in the gut. Pretty much the receptors that will absorb it, they become saturated at high doses. So after around 1,200 milligrams at one dosing period, you don't really get much more benefit. I think one of the biggest problems with gabapentin for neuropathy is the therapeutic dose is a lot higher than people think. To reach that therapeutic dose, you cross into the tolerability range. So, i.e., when you start going higher up in the doses, there's a level at which patients are no longer be able to tolerate it due to side effects. What are the side effects? Dizziness, number 1. Probably 1 in 5 people will experience that based on clinical trial data. Somnolence/drowsiness is number 2. This is almost like 1 in 8. Then there's edema, there's trouble walking, fatigue, eyes kind of twitching. Gabapentin is not without its controversies. Misuse and abuse, that's probably the biggest one from all the headlines recently. When combined with opioids, there's a significant risk for respiratory depression, which means you stop breathing and people have overdosed and died. There was a little bit of a marketing scandal back in 2004. Pfizer had to pay out a $400 million lawsuit because it was making some false claims and maybe fudging the numbers a little bit about some clinical trials. Overprescribing, as we mentioned earlier, gabapentin is given out for a lot of things. There's some concern in the elderly. It needs to be renally dosed and it can lead to falls. And the new one that's you may have seen videos about recently is gabapentin in dementia. There was a big meta-analysis that looked at over 300,000 people, and they found that gabapentinoids were associated with a significant increased risk of dementia. However, whether this was correlation or causation is tough to determine, because one of the big reasons why people take gabapentin is for neuropathy, like diabetic neuropathy. So what if people just had terrible diabetes and that's what's causing their dementia? It's tough to say whether it's the medication or the reason why they're taking the medication. Overall, gabapentin isn't a bad drug. I think it's just a misunderstood medication. Modest efficacy, real side effects, growing safety signals, and a history of being marketed beyond its evidence. I think the best use of gabapentin is when you know exactly what you're trying to do with it.